Assalamu alaikum. Our presentation today is about the third part of the management of dental implant in the aesthetic zone, which it is the soft tissue management. It will be presented by me, Diyar Raad. First, we have different types of incision and technique, and we should know that the planning and design of any incision in the aesthetic zone should be carried out based on the biological principle and with careful consideration of the desired aesthetic outcome. This is the flapless approach, vestibular incision, envelope flap, papilla sparing, triangular, and this is the trapezoidal, that we will discuss them briefly in the next slides. First approach, we have the flapless technique. It is very simple and conservative technique for implant placement, and it is also preserve the soft tissue aesthetic. It shows less soft tissue recession when compared to the flap approach, and as we can see in this picture, this is the tissue punch device, and it is have 3 to 6 millimeter. And here, after the removal of soft tissue, this is after the implant placement, and here, after the placement of the healing. Second, we have the vestibular incision. It is a recent technique that allows the preservation of interproximal tissue and also access for the buccal ridge contouring and soft tissue grafting. This vestibular incision is another minimally invasive flap one can use during the implant placement, and the most coronal portion of this incision, it is terminated well above the high smile line, and therefore any scarring afterward from this incision is kept above the smile line. As we can see in this picture, this is the vestibular incision, and it is facilitate the placement of connective tissue graft during the immediate implant placement with minimal risk of scarring and loss of tissue. Third, we have the envelope flap. This flap, it is elevated from a horizontal incision parallel to the gingival margin with no vertical incision, but we can add this vertical incision and convert it to triangular if there is one vertical, or trapezoidal if we have two vertical incision. And it is have a limited expansion potential for added graft material, but however it is provide a good visualization of the surgical sites. Papilla sparing incision. The papilla sparing technique avoids the papilla elevation, which may help to prevent its loss, which is highly desirable goal in the aesthetic zone. It begins with a horizontal incision in the metacrystal area or slightly palatally, and should be terminated about 1 mm from adjacent teeth. If there is any indication to increase the keratinized tissue on the buccal surface, this horizontal incision should be more palatally, and the repositioning of the tissue to the buccal surface is made. We have a triangular and trapezoidal flap. Both begin with the same metacrystal incision over the implant site and circular incision that continue horizontally for at least one adjacent tooth. We have one vertical incision for triangular incision and two vertical incision for trapezoidal flap. Now we will discuss about the management of soft tissue during the second stage of implant surgery. The management of soft tissue during this stage, it is an important parameter to improve the final aesthetic aspect. Traditionally, they use a tissue punch or full thickness flap opening, but this will lead to bone loss and resulting in soft tissue recession, which it is called unaesthetic implant restoration. So, many different flap designs and techniques had been advocated to reduce these negative consequences. We have modified rule flap, vertical metacrystal incision, pouch roll technique, split finger technique, and we will discuss briefly in the next slides. The first technique in the second stage of implant surgery, it is the modified rule flap. It is a new technique that depends on utilizing gingival tissue over the implant cover screw and rolling it under the buccal mucosa in order to augment the soft tissue labial to the implant. The modified rule flap was first used for a correction of the mild to moderate soft tissue horizontal defect, but then it is translated to the peri-implant tissue for the purpose of the management of mild soft tissue defect around the implant in the aesthetic zone. This technique can spare the problem of donor side morbidity, it is reduce the surgical bleeding, and also it is eliminate the need for second surgical site and sequence post-operative complication, and it is less expensive. Another technique in the second stage surgery, it is a vertical metacrystal incision. This technique is to prevent the buccal marginalization and to achieve an aesthetic peri-implant soft tissue remodeling and predictable implant supporting gingival prosthetic integration. And this procedure has several advantages such as minimal soft tissue trauma, minimal bone exposure, and easy performance. It is done by vertical metacrystal incision between two adjacent teeth that extended buccopalatally, and here after the exposure of the cover screw and the expansion of the flap by using the healing abutment without suturing, here after 3 weeks, and this is after the final restoration and placement. Pouch roll technique. It is a modification of roll flap technique, and this technique is simple, versatile for mild to moderate ridge deficiency by thickening the soft tissue around the implant. In this buccal mini pedicle flap is made about 1 mm larger than the diameter of underlying implant screw, and then is raised, deepithalized, and then following by rolling it underneath the buccal pouch, and here after 3 months of implant surgery. Split finger technique. This procedure is to create both a cervical emergence and elevated interdental and inter-implant soft tissue. The split finger technique is also can be used for 2 or more adjacent implant, and it is very similar to that used for single implant. Like here there is a single implant, the procedure for single implant, and here for double implant, and here after the suturing. We have different grafts that can be used for soft tissue management like free soft tissue graft, free gingival graft, and subepithelial connective tissue graft. Now we will discuss about a new and simple approach in soft tissue augmentation using the platelet-rich fibrin, PRF. But first we should know what is PRF. PRF is a fibrin matrix enriched with cytokine, circulating progenitor cell, and a growth factor, which can be used as a resorbable membrane in surgery. Several studies show a constant release of a growth factor for at least 1 week up to 28 days and prove its accelerating effect on the healing process. And it has been clinically proven that the PRF enable the simple, effective, and predictable management of the gap between the alveolar bone and the implant. This is in turn allow for prevention of secondary gingival recession by maintaining the future level of the biological space. As we can see in this picture, the doctor used PRF for augmentation of soft tissue both buccally and palatally, and after 3 months he noticed there is a noticeable deficiency in the labial contour, so he do a soft tissue augmentation again with the PRF, and here after another 3 months there is a great result. Finally, we have the papilla management and development using provisional prostheses. The immediate implant placement with the provisionalization have been a viable option for replacing single failing maxillary anterior teeth, as it preserves the existing osseous and gingival architecture both facially and interproximally. The aesthetic success of this procedure is influenced by a number of factors that can be identified as intrinsic or extrinsic. As we can see in this picture, they use the prefabricated zirconium abutment, and they also use the subepithelial connective tissue graft because here they have a thin gingival biotype, and here after the placement of the provisional crown and in the radiograph, and here after the 6 months they use the customized zirconium abutment, and here it is the definitive restoration. This procedure have many objectives, which is include maintaining the existing soft tissue architecture, Second, supporting the existing gingival margin and papilla high. Third, a smooth and polished surface that may help to create a gentle transition and minimize contamination during healing. Discussion. In soft tissue management around the dental implant that was performed at the time of implant surgery have several advantages comparable to the soft tissue management at the second stage. It requires fewer surgeries, enable fast hard and soft tissue healing, and produce less pain and provide greater patient satisfaction. The objective of a flapless approach is to reduce the invasiveness of the surgery and this reduce the surgical outcome such as pain, edema, and hematoma, and it is better when compared to the flap elevation procedure. Third, there is a comparison between the flap elevation with the papilla sparing versus the flap elevation with the papilla elevation, which it is the amount of the interproximal tissue loss was far less in the papilla sparing flap incision, which is 0 to 1 mm compared to the flap elevation with the papilla elevation, which is 0 to 3.5 mm. Finally, the modified rule flap technique was effective in increasing the soft tissue thickness, about 1.2 mm to 3 mm within the same group and when compared it to the standard crystal incision. And these results are quite comparable to the standard palatal connective tissue technique. Conclusion. First, implant placement can be done either flapless approach or using an elevating of a flap, and the flapless approach it is more advantage over the conventional flap. Second, the tissue healing has been observed to be improved with the concomitant use of platelet-rich fibrin. Many types of flaps were used in the implant surgery to enhance soft tissue and to create papillae with no proof of effectiveness of one procedure over another. Fourth, the MRF, which is modified rule flap, it is a cost-effective, convenient technique that can effectively augment the thickness of the labial peri-implant soft tissue and help to achieve better appearance in the aesthetic zone. Finally, all techniques of the soft tissue management around the dental implant associated with the great result if we stick the basic principle of correct patient selection, proper surgical approach, gingival biotype, and appropriate implant position. And thank you very much for listening.